right, so what are some things that you can and cannot delegate to LPNs? So I came up with this mnemonic. LPNs cannot enter the cabin. So C, central lines. LPNs should not be doing anything with the central line. Now, you guys, for some of you guys who are LPNs or you work in the facility, you will see that these things vary, right? But when we stick to NCLEX world say no, LPNs should not be messing with central lines. So if you are a person who is an LPN or you work in a facility, you want to put all that stuff on the back burner and you just want to stick to what your book says. NCLEX says that LPNs cannot do anything with central lines. Also, assessment. Your LPNs should not be doing the initial assessment. The initial assessment should be done by the RN. All right, so then blood products. LPNs should not be administering any blood products. Also, the IV medications, LPNs should not be doing anything with IV medications. And then the N, nursing care plans. So LPNs should not be initiating care plans or changing care plans or evaluating care plans to like switch them out. Now, what they can do is they can, once a care plan has been established by the RN, they then can, work within that care plan, but they can't initiate care plans. And if it would need to be changed or anything like that, then the RN would have to do it. So it is important to know what LPNs can't do. Now, LPNs can give medications. LPNs can give medications. LPNs can do CNA work as well. But our biggest thing is to know that the LPNs, they function under the supervision of a RN. So if you have an unstable patient, I repeat again, if you have an unstable patient, that is not the patient to assign to a LPN. So let's talk about some things that LPNs can do. LPNs can do nursing skills such as NG tube insertion, Foley insertion, and draw blood. They can administer oral, topical, sub-Q, and intramuscular medications. They can perform basic wound care and dressing changes, assist with patient mobility and transfer. They can collect specimens for lab tests. They can assist with basic respiratory care, such as putting the patient on oxygen. They can provide education on basic health care and medications. They can document patient care and observations, and they can collaborate with RNs and physicians with the patient's care. So it is so important to know the tasks that your LPNs can do so you can make sure that you're delegating the right tasks.